Welcome to today's video, which is going to be all about bleeding gums. So let's get right to it. In this video, you are going to learn why your gums are bleeding. In a moment I'm going to show you a few things you can do to stop your gums from bleeding, even if you have had no success in the past. There are several reasons you might have bleeding gums. Most often it will be an indication of gum disease or other health problems. However, in some cases, the cause might be elsewhere. Let's look at some possible causes. Plaque causing inflammation is the most common cause of bleeding gums. It often leads to gingivitis or periodontitis. Leukemia, which is a cancer of the blood. Brushing too aggressively or using a hard-bristled toothbrush. Lack of platelets, clotting cells in our bodies. Vitamin deficiencies, especially vitamin C and K. Eat broccoli, tomatoes, peppers, citrus fruits, and strawberries to give your body enough vitamin C. Foods rich in vitamin K include kale, spinach, lettuce, olive oil, Swiss chard. Some medications such as blood thinners that your doctor prescribed for other conditions could cause gum bleeding. Some over-the-counter medications can also thin your blood or cause dry mouth, which could contribute to gum bleeding. Hormonal changes such as during pregnancy. New flossing routine when your gums are not yet used to it, or if you haven't flossed for several days and then resumed your routine. Not properly fitting dentures or braces. They can irritate your gums by robbing them and thus cause bleeding. Braces can also make it more difficult to take good care of your teeth and gums because of the impaired access to the gaps between your teeth. Bleeding or swollen gums could indicate the beginning stages of diabetes. Here are some ways you can stop your gums from bleeding or prevent it from happening. Since bleeding is often the result of inflammation due to plaque buildup, one solution is to simply follow good oral practices. Brush your teeth at least twice a day and floss at least once a day. Use a soft toothbrush and brush gently. You can also use hydrogen peroxide as a rinse after brushing. Hydrogen peroxide is used as a disinfectant, and it works well to lessen the inflammation in the gums and teeth. Try to reduce your stress levels, as stress weakens your immune system in general. When your immune system is compromised, it's easier to get sick and more difficult to fight off infection, which might attack your gums. The next thing that you can do is to stop smoking, if you are a smoker. Smoking will usually prevent your gums from bleeding, as the nicotine contains substances that act as vasoconstrictors. It will, however, lower your immune responses and make you more vulnerable to infections. I mentioned earlier about the need to have enough vitamin C and K in your body, and here's why. Food rich in vitamin C strengthens your immune system and will help fight off gum infections causing bleeding. Lack of vitamin C could lead to bleeding even if you practice good oral hygiene. Vitamin K helps in blood clotting, so when you provide your body with the proper amount, it could help alleviate bleeding gums. Lack of vitamin K, similarly to a lack of vitamin C, could lead to gum bleeding. Diet is an important factor in the health of your gums. Sugars, starches, and carbohydrates promote plaque and bacteria growth in your mouth. As you know, the more plaque, the more likely you will have gum disease, and the more likely you are going to have a problem with bleeding gums. Eat a healthy diet consisting of vegetables and fruits, and drink plenty of water. Drink green tea daily. Green tea has catechin, an antioxidant that helps your body lower inflammatory responses. It will also help reduce the number of bacteria in your mouth and help alleviate gum disease and bleeding. Rinse your mouth with salt water. Salt acts as an antiseptic. When you rinse with warm salt water several times a day, it will remove some of the bacteria from the infected area. If your main goal is to stop bleeding at the moment it happens as opposed to treating the underlying cause, you might want to try a cold compress. Use cold compress by applying it to your gums for 20 minutes at a time. It should reduce swelling and restrict blood flow so the bleeding will slow down or stop. Did you have a problem with bleeding gums in the past? How did you deal with this problem? Did you have any success? Let me know in the comments below what has worked best for you. If you liked this video, please click the subscribe button and hit the bell below to be notified about our next topic. We have more videos about oral health coming up shortly. In the next video, I'm going to be talking about this surprising solution a lot of people are writing raving reviews about, claiming it helped them tremendously with their teeth and gum problems. So don't miss it. Also, click on the link below to get our free daily tips. See you in the next video.